Okay, so I have checked the physician's orders and ensured that I have an order for an indwelling urinary catheter for this client, and I've gathered my supplies. Now I'm going to enter the room and provide the patient with privacy. Hi, my name is Sam. I'm one of the nursing students with NSU, and I'm going to take care of you today. So can I have your name and date of birth? Okay, great. So your provider has ordered for a Foley catheter to be put in, so that's going to help with your urinary retention that you've been experiencing, and you'll feel a lot more comfortable. Is that okay with you that I put that in? Okay, great. So let me just ask, do you have any allergies to latex, betadine, or adhesives? No? Good. Okay, well, first off, we're going to cleanse your hairy area is what we call it. So that'll make sure you're all fresh for the procedure and you're ready to have that catheter put in. So I'm going to go ahead and place a drape over you. And I'll get you into the position. Pull the blanket down. Oops, excuse me. Okay, then I'll lift your gown up. Okay. So this is called dorsal recumbent, and this will help me be able to put that catheter in you. Okay, so first I'll cleanse the area. Okay, peri-care has been provided. And now I'll go ahead and get set up for the procedure. And so I just, with my sterile gloves, touched the 1-inch border, which is not sterile. So I would not have done that, and I would have instead moved my paper by touching the sterile areas of the kit. And I'm going to lay down the sterile drape. So I'll open my betadine, pour it over the cotton swabs, and put the lubricant here in the corner of the kit. And I will attach this. And lubricate the tip. And now I will go ahead and cleanse the urethral meatus. So first, before I do this, I will take one of my hands and I will open the labial folds. Okay. And hold the hand there. And I'll go ahead and cleanse the outside, inside, and straight down the center. Okay, I'm done with this. And I'll go ahead and insert the catheter. And the tip has been lubricated, and I'm going to tell the client, okay, you're gonna feel me insert the catheter. So I'm about to put it in, and while I'm doing that, just bear it down like you have to void. And I'll put it in 1 to 2 inches. Check for urine return, and then another inch to ensure I'm in the bladder, and I will inflate the balloon. Okay, and at this point, I can let go of this hand and I'll check to ensure the balloon has been inflated and it's in the correct spot, which it is. So I'll go ahead and take this, put it in here. And I'm going to teach the client, so make sure while you have this catheter in, you increase your fluids. You don't let the bag touch the ground, and you keep it below your waist. I'll put tape on with slack in the line, and then the bag. So first off, I'm going to check for urine color, clarity, and amount. I'm going to ID the bag, and I will place that on the bed where it won't move. So I will answer any questions that my client may have. I will ensure that she is safe. Side rails will be up ×2. Clean up for my procedure. Oh, and I actually, prior to starting to clean up, I will perform pericare in case there is any betadine left over on her skin. So let me go through that really quickly. This right here. Gloves. These are clean gloves. And pericare has been provided, so there's no more betadine on her. Okay, so now I will go ahead and answer any questions she has. I'm going to check the 4 Ps, although she won't be needing to use the restroom because She is has her catheter now, and side rails are up ×2. Her call light is within reach, and I'm going to lower her bed back down into the lowest position. And I'll let her know that I'll be back soon to check on her and see how she's doing with the catheter. And now I'm going to prepare for the removal of the Foley. Okay, so I have, I'm going to remove the Foley now. So first off, I will have checked the physician's orders and ensured that I do have the order to remove the Foley catheter. And then I'm going to gather all my supplies and enter the room. Hi, I'm Sam. I'm one of your nursing students from NSU. And I'm gonna go ahead and take that Foley catheter out of you today, which I know you'll be happy about. Can I have your, oh, and I've provided the patient with privacy. Can I have your name and date of birth? Okay, great. So we're gonna go ahead and take that catheter out, and now you'll be able to start going to the bathroom just like normal. Is that okay with you? Okay, great. So first thing we're going to, I'm going to empty the bag. So I'm going to assess the amount, color, and clarity that's in the bag. And I will put this linen saver pad on the ground. And urinal here. The urine into the urinal, and then that will be disposed of in the toilet. Okay, and put this back up so it doesn't pull on their leg before I have that removed. Okay, so now I'm going to prepare for the removal. So I'll get you in the dorsal recumbent position. And get that catheter out of you. And I'm going to drape you for your comfort. And lift your gown. And we'll go ahead and get you in the dorsal recumbent position. Okay, so I'm going to assess, make sure the catheter is still there. I'll be doing pericare afterward, but if I needed to for some reason now, I could perform that. So I'm going to take a linen saver pad. Here and remove the tape. Oh geez, okay. And I will have held onto the tubing so it wouldn't fall and just pull down on their urethra like that, so that could cause trauma to the area. So I have my syringe to deflate the balloon. Oh, this one doesn't want it. Okay. I'm gonna hold on to the until I see that I have all the fluid out. Okay, and I'm going to tell the client, so I'm going to pull the catheter out now, so just take some deep breaths. And pulling it out, and then I'll check the tip to make sure it's intact. And set this down. Okay, and I'll go ahead and dispose of the catheter. And now I will provide peri-care. Okay, peri-care has been provided. And I'm going to go ahead and get the client back down in a comfortable position. And I'm going to educate them that when they need to use the restroom for the first time after having this catheter removed, I'm gonna have you call me. So I'll come in and help you and make sure that everything's working like it should. I'm going to check the 4 P's. Slide rails up ×2. Call light is within reach. And I'm lowering the bed down. And any other questions that the customer or that the client has, I'll answer them and I'll let them know I'll be back as soon as they call for me to go to the restroom.